What is a special enrollment period for health insurance, and are you eligible? Hello, I am Kevin Knaus with InsureMeKevin.com, an independent health insurance agent in California, and also a certified Covered California health insurance agent. And if you have missed the open enrollment for the individual and family plans, and in the middle of the year you say, help, I need health insurance, you may be out of luck, unless you have a qualifying life event that triggers a special enrollment period. So first, outside of open enrollment that goes from November to the end of January, during that period, you can enroll in a health plan, no questions asked, no one cares about your circumstances. But once that closes, the market is closed unless you have a qualifying life event. And this applies not only to the individual and family plans, but group plans as well. And these qualifying life events are for 2025. There are some rules that some of these, that may change some of these qualifying life events, and I will highlight those. The largest category of qualifying life events is loss of coverage, where all of a sudden you no longer have health insurance, or your health insurance will be ending. And that will allow you to apply for an individual and family plan. I do want to clarify that if your current health plan is terminated for lack of payment, that is not a qualifying life event. The loss of coverage must be involuntary. The way they look at it is you should have been paying your premiums, and if you didn't, then that's on you. So it has to be an involuntary loss of coverage in most circumstances. And what does that look like? Well, involuntary loss of health insurance might come from because you've lost your job, or you've retired, you've left that employment, and your health insurance ends. Maybe your hours reduced. Maybe you were working 35 or 40 hours a week, and you dropped down to 20 or 25, and you're no longer eligible for the health insurance. That would trigger a special enrollment period. Divorce, where you lose your spouse's coverage for health insurance. Turning 26 and aging off of your parents' plan, that is a qualifying life event that triggers a special enrollment period. Maybe you left your job, you had COBRA, and now the COBRA is ending, involuntary loss of coverage. And if you have Medi-Cal and you report that your income has gone up, they will, and that income is above the Medi-Cal income limits, they will terminate Medi-Cal loss of coverage and allows you to go to Covered California or direct with a health plan to enroll, like Kaiser or Blue Shield. There are some other life events that can trigger enrollment into a health plan in the middle of the year. Marriage would be one of them. Birth or adoption, so because obviously the child coming into the world is covered by the mother's insurance plan for a while, but needs to have their own plan. It might be tied to the mother's, but that would be a qualifying life event. Domestic or spousal abuse, it will also trigger a special enrollment period, so the person who's the victim can get away from the abuser. Other life events, returning from active military duty, because you're kind of covered when you're in the military, but when you leave, in the middle of the year, that's a life event. Released from jail or prison, gain citizenship or lawful permanent residency. Now, do want to highlight that if you go from lawful permanent residency, like a green card, and then you gain citizenship, that isn't a qualifying life event, because if you do have lawful permanent residency, a visa or green card, you can enroll in health insurance. So just moving from that to citizenship isn't a qualifying life event. There are some qualifying life events that revolve around what I call affordability, and they can get kind of really technical, so you have to really look because not everyone's situation will qualify. But COBRA subsidies ending. So perhaps you separated from your job and the employer is covering all or half the cost of the COBRA for a certain number of months, maybe 3, 4, or 5. When that ends, when that subsidy ends and you have to pay the full COBRA amount, that is a qualifying life event to enroll in Covered California or direct with the health plan of your choice. Loss of Covered California subsidy. That's interesting. Well, and there can be a couple different reasons why someone loses the subsidy. They're no longer eligible for the APTC, Advanced Premium Tax Credit Subsidy. But when that happens, that is a qualifying life event to enroll in a plan. And this would be generally off exchange. The silver plans through Covered California they have a surcharge, so they're 5 to 10% higher than a silver plan off the exchange, direct with a carrier, Kaiser, Blue Shield, Health Net, Molina, whoever it is. So that allows people to take advantage of a lower cost silver plan because they're no longer getting a subsidy. Loss of a third-party payer. Perhaps someone has a trust that has been covering the health insurance for someone, and for whatever reason, that third-party entity is no longer going to be covering the health insurance. It's a qualifying life event. Group plan renewals, and this is where you may be in a group plan, and the group plans aren't necessarily on a calendar year, January through December. The open enrollment can be in the middle of the year. So if that happens and your rates go up tremendously because maybe the employer isn't contributing anything to reducing your health insurance premiums, or that of your spouse or your dependents, that can be a qualifying life event. Then if the employer offers what is called the ICRA or the QSERA, and you'll see that if it's given to you. And in those situations, it allows the individual to go to the exchange or outside, and then they make a contribution. You would get information on that, but that would trigger a qualifying life event for a special enrollment period. Other situations that will trigger a special enrollment period: if your county is in a state of emergency declared by the governor, a disaster, maybe a wildfire or a flood, that will trigger a special enrollment period. If you had to pay a penalty on your California income tax return for not having health insurance the previous year, and you had to pay a penalty to the Franchise Tax Board, that triggers a special enrollment period for you to enroll in health insurance. If you are what they call an app-based driver under Proposition 22, I believe it is, Uber, Lyft, the DoorDashes, and you're working enough hours to become eligible for the stipend from that company to reduce your health insurance, when that happens, that's a qualifying life event to enter into Covered California or directly with the health plan of your choice. If you've gained DACA, Deferred Action for Childhood Arrivals, that would be a qualifying life event. That might be going away here shortly. Kind of a technical one is if you have a provider, a doctor that you're receiving care from, and that doctor leaves the network of the health plan that you're in. They're no longer a participating provider, and you can't receive services from that doctor. That can be a qualifying life event, but you got to really dig into the details on that one. Moving to California, yes. If you come to California from another country or from another state and you establish residency, that is a qualifying life event, because generally your health insurance in the other country or the other state isn't going to work in California, so you need something local. Now, most of these qualifying life events that trigger a special enrollment period. That special enrollment period lasts for 60 days. You have a 60-day window from the date of that event to enroll in health insurance. There are some health insurance coverage that you can enroll in on a continuous basis with certain conditions. For example, if you are Native American or an Alaska Native, you have a continuous kind of an open enrollment, you could say, to enroll at any time outside of open enrollment. Medi-Cal is open year-round, so if your income drops, and maybe you didn't have health insurance and you have zero income, then you can enroll in Medi-Cal. If your income for the household is less than 150% of the federal poverty level, but above the Medi-Cal limit of 138%, you can enroll through Covered California. And that's one of those qualifying life events that may be going away. With all of the qualifying life events, be prepared to verify the event. Be prepared to have documentation. Sometimes you need to supply the documentation to the health plan before they will actually enroll you. And Covered California may request that you provide the documentation. If it's moving to California, you'll probably have to have, some invoices, receipts showing the date and the address that you're using. Obviously, it's a birth or adoption. It may be a birth certificate. Ending of COBRA, there's usually a letter that states exactly what date it will end on, and the date of that letter needs to be within the last, I believe, 60 to 90 days of the end date. So that's all documentation that you need to have for a qualifying life event. So it can get kind of technical, but there are ways to enroll in health insurance outside of open enrollment if you have a qualifying life event to trigger a special enrollment period. If you have any questions or comments, you may leave those down below, and I will do my best to answer them. Otherwise, for insuremekevin.com, I'm Kevin Knaus.